Who is susceptible to getting trapezius muscle pain? Who are the people at risk? Generally, people who are redundant or people who are not active, people who are not as active. These are the number one people who are actually affected by the trapezius muscle pain. Somebody says I was sleeping, in the morning I wake up, I'm feeling pain in the neck and the shoulder. Probably it could be a trapezius muscle pain. Mostly the people who are not athletic, people who are redundant, people who are not very active. It could be triggered by several other factors, which we shall talk about. But mostly the people who are susceptible generally are people who are not as active as much. And it is less in those people who are active. That is number one. So therefore, people who are susceptible are people who spend a lot of hours in seated positions, especially those in office working, those who are working in office. Every time they're on the laptop, they are on the keyboard, the head is tilting down, they're typing. Those ones are more susceptible. The younger generation using the phone, every time they're checking the telephone, they're checking the messages, they're checking the WhatsApp, they're checking the TikTok. These ones also are susceptible to that kind of pain. And then also the people who are sleeping in awkward positions. People who are sleeping in awkward positions may be using a very high pillow which is very high, or a pillow which is very low, or using no pillow at all, or changing into awkward postures when you are sleeping. Because this muscle has a very important role in maintaining the stability of the head. So whenever you are in those awkward positions, you put it at risk because it is trying to stabilize. So mostly these are the common people who are affected by the trapezius muscle pain. People who are commonly redundant, people who are not as active as much. So the office workers, people using the laptop, computers a lot of the time, people who sit a lot, most of the people who are sitting more times, people using mobile phones, and people using pillows, awkward pillows who are bigger pillows, those who are using very small pillows, those using very old pillows, those who use no pillows at all to support the head during the sleep. So these are the people who are susceptible. So what causes the pain? From the people who are susceptible, you can now knock it at what actually causes the pain. What causes the pain is awkward positioning of the head, because the trapezius muscle is a very important muscle for us to maintain the stability of the head on both shoulders. So it is trying to stabilize the head on the shoulders. So whenever you are doing prolonged activities which are involving awkward tilting of the head, this muscle is going to be tired, and then it can cause spasms and trigger a pain response because of that function, because it is trying to figure out the stability of the head, and maybe you are just facing down for a longer time. Maybe you are awkwardly looking at one side because you are checking the phone. Maybe you are sleeping awkwardly on the pillow. So in terms of trying to achieve the stability of the head and the rest of the body, this it can trigger a pain response. So the person feels pain. So what causes it? Number one, sleeping in awkward positions. It causes a lot of trapezius muscle pain, especially the people using too high pillows who are very big pillows, those using very low pillows, and those who are using no pillows at all. These ones are susceptible. So these are the people who wake up in the morning saying, I feel a lot of pain in the neck and the shoulder. So those are one group of people. Another group of people using the laptops and the computers, people doing the desk work. Those people are more susceptible to the trapezius muscle pain as well because of the positioning of the neck and the head. And then those who are looking at the mobile phones most of the times also are susceptible to the trapezius muscle pain. So those are the groups of people who are at risk and what actually causes the trapezius muscle pain. Next, we shall talk about how can we manage, how can we handle, and therefore how can we prevent it from happening again.